I'm sure you've heard the term rotator cuff tear, but what does that term actually mean? What signs or symptoms might suggest you tore your rotator cuff? And what treatments exist to help you heal and return to the activities you love? My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. Now, rotator cuff tears, one of the most common shoulder injuries there are, especially as you get older, very, very common. What the rotator cuff is, I'll show you on this shoulder model, is it's basically a series of muscles that come off your shoulder blade. You can see it there, 3 in the back, 1 in the front, that basically run under the tip of your shoulder blade there, and they run and attach to the ball of the ball and socket joint. And what those rotator cuff tendons and muscles do is they stabilize the ball in the socket, while the bigger muscles help you reach up overhead or out away from your body or behind your back. When you're younger, teenagers, 20s, maybe 30s, you need a very, very traumatic event to potentially tear one of your rotator cuff tendons. And a lot of times, even with a very traumatic event like a shoulder dislocation, you don't tear your rotator cuff. This is very commonly an injury of 40 and beyond. Now, that's not to say that when you're younger, you can't have rotator cuff issues, but at that point, it's usually rotator cuff impingement or shoulder impingement, and I'll talk about that in another video, or maybe a partial tear. You don't typically have full thickness rotator cuff tears before you hit age 40 or so. Now, with older patients, and again, I say this not in a negative way, but 40 and older, it can happen, one, with a traumatic event like a shoulder dislocation, very, very commonly going to tear multiple rotator cuff tendons if that happens in, say, a 50-year-old, 55-year-old, or it's wear and tear over time, repetitive reaching up overhead with things like tennis or golf, or any kind of throwing, any repetitive activity overhead. Manual labor can do it. And then those tendons basically gradually wear out and ultimately tear. Now, as far as treatments go, very often that rotator cuff tendon, that torn rotator cuff tendon, doesn't heal on its own. So for the last maybe 30 years, first it was open shoulder surgery, then it became arthroscopic surgery to reattach the tendon has been necessary. And I still believe that that's the case. Could some of the newer regenerative treatments help? Maybe, but maybe to augment the recovery from the surgery, not just to help it heal without surgery. Now, what that means is the surgeon goes in, scopes the shoulder, and then basically uses sutures and anchors to hold it in place. But then it's a lot of time sort of protecting that repair. So you'd be in a sling for a period of time, and then slowly working to get your motion back. And then after that, slowly getting your strength back. And a lot of that requires physical therapy. Once you've got full motion and full strength, then you do more repetitive overhead activities and progress to sports and exercise specific training. It's a long process. It can be 6 to 12 months before your shoulder feels like it did before you suffered the injury, before the rotator cuff tendon tore. If you don't have surgery, especially the younger you are, it seems like, based on the research out there, that because that tendon doesn't heal, you get more breakdown of the shoulder itself. That tendon pulls further and further away, and it gets to where then, if you decided to have surgery, you can't get it back out there. That rotator cuff muscle starts to atrophy. That ball starts to rise compared to the socket, and you get wear and tear type of arthritis changes, what's called rotator cuff arthropathy. And it's certainly good to prevent the shoulder from getting to that point. So even though, yes, I know there's a lot of movement towards regenerative treatments and peptides and various things, in younger, active people with rotator cuff tears, very often surgery is the right way to go. Doesn't mean there's not a role for some of those treatments. Maybe peptide can speed or improve healing of that rotator cuff tendon fixed surgically. Maybe something like a growth hormone releasing peptide like CJC 1295 might improve the strength of the muscles around the shoulder to get your function back faster. Maybe some of the regenerative treatments like PRP or stem cells or exosomes might help with rotator cuff arthropathy and arthritis that happens after the fact, but those probably wouldn't be the primary treatments. I get a lot of people that reach out about peptides or various things to speed recovery. Some people ask if they would basically help the rotator cuff heal without surgery. There's not really a lot of human data about that. Most of the, especially with peptides, animal data. In theory, it's one of those things that makes sense, but usually those treatments are an augmentation to the surgery and physical therapy, not standalone treatments. Again, those are considered experimental or off-label, so I'm not promoting them. You can watch other videos I have on those treatments on my channel to get more information about what I mean by experimental or off-label. But I do get a lot of people that ask about those, so I thought I would address that here. Anyway, rotator cuff tears, rotator cuff injuries, very, very common, very difficult injury, but can have good outcomes if you see a shoulder specialist and get it treated appropriately, get it diagnosed appropriately, and then if you end up needing surgery, are willing to do the work, the time, whatever is necessary to get it back to 100%. It can have good outcomes. All right, I'd love to hear about your experience with your shoulder injury, rotator cuff or otherwise. Leave those in the comments below. Just know I can't offer you medical advice, but I'll try to answer your question in a future video. Make sure to subscribe to this channel, click the bell to be notified when I release a new video or start a new live stream like my Ask Dr. Geier live shows. If you have knee, hip, shoulder, or some other bone or joint pain, and you want to get significantly better in the next 30 days, potentially without cortisone shots or without surgery, look in the description below this video. You can learn more about working with me. Thank you so much for watching. I look forward to helping you feel, look, and perform better than ever.